I want to tell you about my friends at OIP, the Orthopedic Institute of Pennsylvania. OIP is a state-of-the-art orthopedic facility that offers patients access to some of the finest orthopedists in the country, as well as a full spectrum of orthopedic care. Dr. Halleck, thanks so much for taking some time to chat with us today. Now, it's so exciting here at OIP. You're known as an orthopedic center of excellence. What does that distinction mean, and why is it important to your patients?
Well, I think what makes OIP a center of excellence is that we have 18 surgeons, and we're all surgeons that have been trained through their residency in general orthopedics, and then we also have a group of surgeons that have subspecialties within orthopedics, such as joint replacement or spine surgery or hand surgery or shoulder surgery. So we can offer specialized care for the special problem patients that come into the office.
OIP offers comprehensive musculoskeletal services. Now, it's not an easy phrase to say, but I know it's really important to your patients. Tell us about that.
At OIP, we can provide patients not only with the medical care that they're seeking here in our group, but also other services such as MRI scans, physical therapy, braces if they need them. And the beauty of having those services right on our campus here is that if a patient or one of the physical therapists has a question, they can just drop down and ask us directly. Or if the tech who's taken the MRI scan has a problem positioning a patient in our scanner, they can come to us directly and get help. Plus, we can get immediate feedback on the computer system when we need to see the results of those scans. I think most patients are very grateful that we do that. It's a convenience for them. And luckily with this location here in Camp Hill, this is just one of our 3 offices, but with this particular location, it's very centrally located in the Camp Hill area, and it serves not just Camp Hill, but Lemoyne, out to Mechanicsburg, down toward Dillsburg, and it's very easy for patients to get here with the interstate system and with the road access. And so it's very nice for patients to get here, and then they can do basically one-stop shopping for a lot of their orthopedic needs.
We're here with Dr. Brett Himmelwright. Dr. Himmelwright, thanks so much for speaking with us today. Now, OIP is known as an orthopedic center of excellence. What does that distinction mean, and why is it important for patients?
Well, the concept of a center of excellence is that you have various physicians that have special interests. And why that's important for patients is that the doctor that they're seeing has a different insight or a more deeper insight into their problem, and oftentimes much more experience with that problem. Of course, that provides much better overall patient care. We do have some physicians who are fellowship trained and subspecialized in other areas of orthopedics. So we try to make it so that everything is essentially under one roof, that we can offer the full range of orthopedic and musculoskeletal services to patients and try to make it a little bit easier for them. Because both the x-rays and the MRIs are done through a digital system, the days of actually having to print out x-ray films and carry those to the doctor and those things are really gone. So what that allows us to do is we can not only view the images essentially immediately after being done, also allows us to do a lot of other things that you could never do with traditional film x-rays, as far as expanding and measuring and modifying those images to see the things that we need to see. There always seems to be that little added benefit if the therapist is having a problem, that they can simply walk downstairs and they can pull you aside and ask if they have any questions or any problems with your patients, and it seems to make the whole system run a little bit smoother, and I think it provides a great benefit to the patients and to the patient care. We can provide them with the full spectrum of care here. We can go from diagnosis through the treatment process. We are on staff at every hospital that's in the Harrisburg area, including Holy Spirit and both of the Pinnacle facilities. So we can pretty much provide care wherever you need it. We can provide the diagnosis here on site, and by doing that, I think it provides a comprehensive approach to the total orthopedic package.
That's another big benefit of working at this facility. The communication issue is great. It's great to be able to walk downstairs, communicate with the physicians, change treatment plans, get scripts. It provides comfort to the patient knowing that you're able to walk downstairs and get that information as well. It makes the process a lot smoother and more comfortable for the patient.
You know, my family always gets together for the holidays and we always have a touch football game. And we were just out playing a little touch football with the kids and planted that right foot and my knee just went and down I went. And you know, I knew something bad had happened, so I went to the hospital that night and they recommended that we come over to OIP the next day. I got to see the doctor and just took his time explaining what had happened, you know, and that they were going to give me an MRI. And so saw him, and the next day came right here for the same place and went into the MRI booth. It was, I totally blew out the ACL. I also tore the MCL and the meniscus as well. So basically what it's called is a total knee reconstruction. So they're going to, basically they just put a new ACL ligament in. They screw it in 2 places. He fixed the meniscus and the MCL will just heal on its own. I'm just about 4 days out of surgery and really the pain has been minimal. They work really well with you here. Once I did my injury, I got through a wedding and a honeymoon before the surgery. And during the surgery, right before the surgery, they gave me a new thing called a femoral nerve block. And that really helped to eliminate a lot of the pain management. And Dan has been excellent. He's kind of the protector here. He protects your knee before you go to surgery, and he's protecting your knee during the surgery and after. So Dan's the man around here. But the doctor did a great job, and I come in tomorrow, they remove the bandages, and then I'll be able to take the brace on and off. I like him. He's straightforward. He's one of those people who will tell you just like it is. They have a lot of props here they can use. And you know, he just tells you straight up, this is what I would do if it was me. And I trust that. I trusted that. Don't be scared here. It's really a one-stop shop. Any type of injury that you sustain, they can do the MRIs here. You have a great group of doctors here. They perform all the surgeries and all the physical therapy, all from one place. And I can't beat that. I start physical therapy next week.
Well, originally I was having back problems. Dr. Himmelwright, who's my doctor, did back surgery on me, fixed up what had been done in 3 prior operations. Now I'm like new with my back. And every doctor I went to, I would tell them about my hip bothering me. Well, they would take x-rays, never find anything. My faith never let me down. I said something to Dr. Himmelwright. He said, well, let's see an x-ray. So he sent me over to x-ray, took an x-ray, he come back, he says, well, no wonder. He said, this is your problem. Arthritis, degeneration, the whole 9 yards. Today, I'm doing things that I can't remember the last time I did. It had to be before the year 2000. I was in pain and probably didn't realize I was in pain because I was so used to having pain. Now I don't know what pain is. I can get up in the morning, go fix my cup of coffee and drink it, and I'm not reaching for the pain pills. He took the time to answer all my questions, explain, put my x-rays up on the computer, showed me exactly what he was going to do and how he was going to do it. Stephanie, which is Dr. Himmelwright's secretary, you call her, she's right on the problem, whatever it may be. If you need to talk to the doctor, he may call you after hours. When you come in the door, there's someone there to give you a smile and say, how can I help you today?
I had a hip replacement elsewhere, and it was a nightmare, a year of hell. The leg is dead from the knee down, foot drop, constant pain. So I needed a second opinion. And I got an appointment with Dr. Halleck, and he looked at it, and in less than 2 years, Dr. Halleck has done 2 hips and 1 total knee. And I could just jump buildings now. Whenever I would call his secretary, Chris, I would get a call back within hours. I've been in the medical profession my whole life, and you can go 2 and 3 days before you get an answer to something. The doctor and the staff are incredible. It's a package, and a lot of that is because of the doctors.
I think starting first off with the facility itself, we're fortunate to have a lot of space. We have a lot of modern equipment at our disposal. Also, the staff we have here is second to none. We have several therapists that specialize in treating back and neck injuries, as well as 2 certified hand therapists. And that allows us to treat the gamut of orthopedic injuries, from the simple sprain and strain to the complex joint replacements and injuries as that.